No one wants to wait in an emergency department for treatment. Often, an urgent care center can get you seen faster. We asked Dr. Ricci of Hoag Memorial Hospital Presbyterian in Newport Beach about which one may be the best choice for you.
Urgent cares are typically freestanding facilities, not associated with a hospital, whereas emergency departments are associated with a hospital. And the kinds of patients that urgent care sees would be generally considered much less severe or life-threatening than what we see in the emergency department.
Dr. Ricci discusses the benefits of going to an urgent care center.
The benefits of seeking care in an urgent care center are considered, or some people consider it to be cost as well as timeliness of care. Sometimes emergency departments are overwhelmed and waits for relatively minor conditions are long because we have to prioritize the most severe conditions to be seen first in the emergency department.
We asked Dr. Ricci about those long waits at the ER.
What happens when an emergency department is overwhelmed is that waits become very long. So people in the community who need access to emergency care have to wait for that care. In addition, what happens is that patients get frustrated with the waits in the emergency department. Patients in the waiting room sometimes get overwhelmed with the wait and leave without treatment. When that patient leaves, they clearly would have risk for worsening conditions or potentially life-threatening conditions that aren't treated. Emergency department waits are really not a function of what goes on in the emergency department. They're not a function of how many patients show up in the emergency department. What they're really a function of is what's happening inside the hospital. When a hospital is full, the patients that I see in the emergency department that need to go up into the hospital to get further care, to be admitted to the hospital, can't go up into the hospital. So the question is, well, where do those patients go? The answer is nowhere. They stay in the emergency department until there's a bed.
Which conditions are mostly seen at an urgent care center?
Generally, patients that have minor illnesses, colds, sore throats, mild headaches, mild fever, problems with their hands or feet may access care in an urgent care center. However, the complications arise when we take into consideration other factors. Patients' past medical history, for example, if it's complicated, may make their simple complaint more complex that won't be able to be cared for in an urgent care center. The urgent care center's facility, their expertise, their ability, their equipment, their ability to provide medications might be limited. Their hours might be limited. There's financial issues involved in urgent care. In the emergency department, we take care of all comers, regardless of their ability to pay. That generally is not true in urgent care centers.
And when should a person go to an emergency room?
So many circumstances enter into patients' decisions to come to the emergency department that's very difficult to define an emergency versus urgent care. And we're left with that prudent layperson definition, which basically is if you believe, and you're reasonable, that you have a potentially emergent condition, you should go to the emergency department. Ultimately, I felt that emergencies are like beauty. They're in the eyes of the beholder.
Join us next time when the American Health Journal brings you more in our ongoing series of reports for your better health. If you have questions about topics on this program, or for the doctors you've seen on today's show, you can contact us at 1-800-303-3200 or check out thedoctorshow.com. Until next time, I'm Roger Cooper for the American Health Journal.